because I just want to point out that the governor's numbers, lieutenant governor's numbers, are not matching reality. What we're hearing from, again, members and providers. And Senator Feenstra in Ways and Means today was taking up the mental health levy bill. That's very important. And even a couple of the providers stood up and talked about Medicaid and Medicaid payments and some of the issues surrounding the managed care delivery system. So here's the first point that the governor and lieutenant governor make. Preventing hospital admissions and reducing unnecessary readmissions. Well, hospitals were already well underway with admissions and readmissions under the ACA and under a health homes policy. It was already being done. Point 2, empowering patients by knowing their health risks and needs. There is no measurement that supports the statement. And when MCOs were asked at the last Medicaid oversight meeting, how will you know when managed care is a success? What data will indicate that? The MCO said it would take more time. Coordinating care for the most vulnerable patients and ensuring healthier outcomes. That's the third point. They do coordinate care for the most vulnerable patients, although there is criticism over unreturned calls, sloppy case management, and worker shortages. Ensuring healthier outcomes is still something that has yet to develop through a longer collection of data. Fourth point, utilizing preventative health and wellness services never offered before in Medicaid. I have heard time and time again that it's true that patients are getting different preventative health and wellness services, but they can't find transportation to some of these services. If it's a health service, or if it's the Boys and Girls Club, or whatever it is, there are always predicaments around transportation. Point 5, saving taxpayers $110 million in FY17 and $232 million in FY18. This comes up time and time again. Here's what this is. This is what the MCOs are spending versus a projection of what it might have cost under fee-for-service. It is a projection. This is not real. Again, that's why the MCOs can lose hundreds of millions of dollars, and at the same time, the governor is saying that we're saving money. So I hope you understand that very important point. Then under the better outcomes of the media release, it says hospital admissions and readmissions. They say that hospital admissions are down 54% overall. Wow. Here's the ugly truth. That hospitals are continually battling with the MCOs over appropriate classifications of patients. For instance, if a patient comes into the ER, they're sick, unstable, or mentally ill, the MCO is now telling the hospital that these patients are observation patients, and that classification has led to the admission number looking much lower than the comparison of what we used to do. Hospitals report an incredible increase in observation stays, and hospitals are not getting paid. It is much cheaper for the MCOs to do this. That's the ugly truth.